Greetings and welcome to Healthy Heart at Dr. Shankar Surgery. The endoscope is now inserted into the wound at the knee, facing downwards towards the ankle. The gas seal is then set in place and its balloon cuff inflated before continuing with the operation. As before, the outer circle is set against the long saphenous vein and used to guide dissection. As the spaces within the leg are tighter than they are in the thigh, more careful dissection with the point of the dissecting tool may be required to open up the spaces. On occasion, other tissues may be closely adherent to the long saphenous vein in the leg. For example, here on the right-hand side of the vein, the saphenous nerve may be seen. The nerve itself and the invisible fibres ramifying from it supply part of the sensation of the skin above the long saphenous vein, and surgery in this region may give rise to numbness of the skin. With the front of the vein exposed, it is time to work on the back. The endoscope is withdrawn from the ankle to the gas seal. Here, the tip of the dissecting tool is employed once again to find the tissue planes immediately behind the long saphenous vein. The tributary is found and quickly exposed. The tissue plane behind the long saphenous vein has been exposed. The endoscope and dissecting tool are advanced into the space, setting the outer circle onto the long saphenous vein as we dissect. Similar to working in the thigh, the tissue planes behind the long saphenous vein in the leg are tighter than they are in the front. The work is correspondingly slower, but the principles remain the same. The sharp tip of the dissecting tool comes into its own here also. Where the tissue planes are especially tight and it is hard to dissect them out conventionally, gentle use of the tip can help to open up the planes. Having reached the level of the ankle, the telescope is then retreated back up the leg while dividing the remaining loose tissues by the side of the long saphenous vein and also further improving the exposure of any tributaries along the length of the vein. This is initially done from below upwards and then from the front backwards. The right side of the long saphenous vein has been freed up, and it is now time to clear the left side of the long saphenous vein. Following this, the tributaries to the long saphenous vein are diathermied and divided.